So welcome to today. This is called the ABCs of the progression of addiction, recovery, and relapse. So today what we're going to do is we're going to take a look at, first of all, how do people get into trouble with alcohol and drugs? I have never known anybody whose main goal when they started drinking or using was to become an alcoholic or addict. Have you? No. You know, that's clear out of the realm, right? So what we're going to start with, I'm going to talk about, look at all these substances we have. We have the pain pills, we have the alcohol, we have cocaine. There's all kinds of choices. So the first question is, why do people use alcohol and other drugs? So let's just brainstorm just for a minute. What are some reasons people use alcohol and other drugs? What do you think?
Stress relief.
Stress relief. What else?
Social pressure?
Social pressure. Anybody else? Curiosity.
Well, and they may have a lot of trauma or emotional issues.
A lot of
They're
trauma,
trying
emotional
Right.
issues, so they want to self-medicate for that. So, there's a lot of reasons that people do. And people keep using because alcohol and other drugs work. They do what they're supposed to, right? They make people feel the way they want to feel. Otherwise, why go there?
Or not feel.
Or not feel. Some people don't want to feel. Some people want to feel intensely, right? And they mistakenly believe the only way they can do that is with external supply of chemicals. Their neurotransmitters aren't enough. And as we'll talk later, in some cases that's absolutely true. That's called either the addictive brain response or the reward deficiency syndrome. And I'll talk more about that in a little bit. So what we want to take a look at is, what do people want alcohol and other drugs to do for them? So we've just mentioned a few of them, but let's go through it piece by piece. What do people want alcohol and drugs to do? Well, they start using, some of you already answered, curiosity. Absolutely, that's number one, especially adolescents. That's the big one. The next one is that peer pressure, the social pressure. Well, everybody's doing it. And when I was out in my addiction, I thought everybody was like me. And then I found out that's not really true. That's not really true. For example, 10% of the people who drink alcohol drink about 80 to 90% of alcohol that's sold. Staggering number. Staggering number. So most people are social drinkers. And social drinking is maybe once or twice a week, 1 or 2 drinks per occasion. And they get intoxicated maybe once a year. That's the definition of a social drinker. So, but when you're in the wrong social crowd to where drinking every day or binge drinking on special occasions, sometimes special occasions are weekends, that could be a problem. And there's the cultural response. In my family system growing up, alcohol was the mainstay. My alcoholism goes back on both sides of my family for generations. So everything revolved around alcohol. Every social party, every funeral, every wedding, every holiday, fishing trips, camping trips, the very first thing that got packed was the alcohol. And it was just very common. And I'm the oldest of 9 boys. And I can remember between ages 7 and 10 that when my parents' turn was to have a party at their house, I was in charge of the cleanup crew the next day. And I was cleaning up from a very young age, and a lot of people believe that drinking and drugging is a normal part of everyday life. They honestly grew up that way. They were exposed to that. And also, a lot of people want a mood alter. They want to get high. They want to feel that excitement, that euphoria, that they don't know how to get any other way. They don't feel alive. And for me, that happened at age 12. At age 12, I got injured playing sandlot football and got rushed to the emergency room, and they shot me up with something, probably Demerol, looking back, I don't remember, but I do remember what they sent home with me. They sent me a prescription of Tylenol codeine. And here I am at 12 years old, the oldest of 9 boys, Mr. Super Responsible. And if my brothers got in trouble, not only did they get punished, I did too for letting them get in trouble. So, man, I had a lot of pressure on my shoulders. Had just switched to really, the school load was getting really intense on me. getting, it was a Catholic school and we're getting ready to go into high school pretty quick. So it was really intense. And so when I took that Tylenol codeine, all of a sudden I was at peace for the first time in my life that I could ever remember. It had an amazing result, an abnormal result. Most people take that medication, they don't like how it makes them feel. It makes them feel groggy or distorted or upset, nauseous and everything, but me, no. It made me feel good. And a lot of people get that. Some people, like I mentioned earlier, they want to chill out. They want to relax. So there's many reasons that people, drink and use. Have you seen anything negative so far? No. These are all human needs, right? To mood alter, to relax, to socialize, to fulfill curiosity. There's nothing wrong with that. It's how you go about it that can have good or bad outcomes, though. But when people are into this, they only see the good side. They don't see the danger sign. And we'll talk more about why that happens later. They also, to be more social, it makes it easier, especially people that have some kind of social phobia or low self-esteem, fear of being in groups and stuff. And they don't know how to have fun without doing that mood altering first. So, of course they're going to want, if they find, wow, this really helps me, I'm popular now. For the first time, man, I can fit in with everybody. So why shouldn't I? And to manage emotions. This is a big one. You see the quotation marks around bad feelings? Well, I don't believe there's any such thing as good or bad feelings. They're either comfortable or uncomfortable. It's what you do with them that cause good or bad outcomes. So for some people, though, when they have uncomfortable feelings, they don't know how to cope, but they know if they just drink or drug a little bit, everything will be fine. And I can feel good again. And for some people, feeling good isn't good enough. They want to feel better. And they want it now. They call that instant gratification. I had one client come in and he says, Steve, there's only one thing wrong with instant gratification. It's not fast enough. We want more intense. That's the addictive brain. And it doesn't matter what the substance is. And yes, some people can get addicted to food. I was addicted to chocolate. I haven't had chocolate since 1996 because I was a binge chocolate addict. And it was really bad. And it also triggered sweet tooth for other sugars. So since I've quit chocolate, it's been much easier. That's the main reason I wrote the eating addiction workbook, was for my benefit, because I have to practice what I teach. Now, a lot of people also use to get more energy, to perform at work, to perform in sports, to help them get up and get going in the morning, to keep them going if they work long hours. Talk about a process addiction, workaholism, right? Overworking. A lot of people have that one, and so they use substance to keep going, or to perform better, or to mistakenly believe they're performing better at school or work. And to block out pain, get rid of unpleasant thoughts, feelings, and memories. So those are some big things that people use alcohol and drugs for. Some people also do it to be more spiritual. And, they want to have an altered consciousness. And you look back through our recorded history and you see that there's always rituals around substance. A lot of the indigenous population will use different things. Peyote is one, for example. Back in the 60s, Timmy O'Leary was talking about acid being the gateway to spirituality. Bill Wilson, the founder of Alcoholics Anonymous, even used LSD for a period of time to enhance spirituality. So it's been a big process that's been through history. To have those mystical feelings and not willing to put the time into a discipline like meditation to get that. Because you can get all these in other ways besides substances, but some people don't think so. To get spiritually connected. Ellen is into trance dance. She's a movement therapist, a coach rather. She gets she trained in Hawaii for about a month to become a trance dance facilitator. And it's a process to achieve all this through movement and music and sound. And it's a really awesome experience. I've done it with her 3 or 4 times and it always blows me away that you can get high without taking anything and have this kind of connection, this deep spiritual connection. It's amazing what can happen, but some people think it takes drugs to do that. So with that, we're just going to stop for a minute and we're going to have just a little bit of brief discussion.